and I am going to be walking you through an overview of the performance measurement tool and the process around it for you today. So what are we going to be discussing today? Today, I want to get you acquainted with the basics of BJA performance measure reporting, the basic process. I'm going to provide you an overview of the structure and content of the questions you will answer in PMT, and give you some tips for handling common reporting challenges. Please keep in mind that there is a separate training covering PMT system navigation issues that was conducted in December 2019 and recorded for you to refer to later. This other training is directed towards grant programs in general using the performance measurement tool, not just this SCA program. It covers topics such as setting up your user account, generating reports, and an overview of how to navigate the PMT. This first section of the training will provide an overview of performance measures and the reporting process. So what exactly is the Performance Measurement Tool, or PMT? The Performance Measurement Tool is the online data collection tool for Office of Justice Program grant recipients. It's structured as an online questionnaire made up mostly of short answer questions, which grantees submit once a quarter throughout the life of their grant. Keep in mind, the Performance Measurement Tool, or PMT, is a separate system from the Grant Management System, or GMS, which you use to manage and report on many other aspects of your grant. Twice a year, we require you to generate a report out of the PMT system that you will upload into the GMS system. This allows the information you report into PMT to be accessible to all the grant program managers at BJA that you work with. At the bottom of the slide is a link to the PMT website, which you can explore once your login credentials are created. The important quarterly deadlines that you have to keep in mind are highlighted in the lower left-hand corner: January 30, April 30, July 30, and October 30th. The year is divided into 4 periods of activity. During the months after the end of the reporting period, the system will be open for you to submit your PMT data. After you submit your data, your answers will be locked, and you will need to contact the PMT help desk to help you unlock and edit reports as needed. However, the PMT is accessible year-round to review data. The second to left column shows the type of data you'll be reporting each reporting period. For every period, you'll report on performance measures, which are essentially short answer questions, but for the reporting periods due January 30th and July 30th, as well as at the end of your grants, we'll ask you a couple of key open-ended narrative questions related to your progress against goals. Also for these periods, you will need to generate a report of your PMT data and upload it into GMS. On this slide are links to the Performance Measurement Questionnaire PDF document, which lists out every question you will encounter in the online system in PMT. There are 2 links. The first one is to a main document, and the second is for a supplemental section related to healthcare coverage, which was developed later. Please remember, it is easier to track data outside PMT on an ongoing basis and then add it all together when it is time to report into the PMT. A large part of today's webinar is focused on the actual questions you'll see in PMT. But before we dive into that, what in a nutshell is performance measurement training to capture? Well, essentially, performance measurement aims to capture information about inputs, which refer to your program resources, activities, which essentially turn those inputs into outputs. Maybe you do risk and needs assessments and case management, and that in turn results in numbers of people served. And outcomes can be longer term or more bottom line type of things, such as the number of participants who actually completed a set of requirements for your program or obtained certain outcomes when it came to housing, employment, or improved recidivism when they came out of your program and out into the community. And of course, much longer term, our bottom line interest in capturing data is some indication about reduced recidivism experienced by your program participants. And how do we use this information? BJA uses it to help us understand your progress, respond to Congress, the media, which in turn really helps to secure funds for projects like yours in the future, and it provides the accountability that is required by law. Now, let's get into the type of questions you will encounter in the performance measurement tool. As mentioned earlier, most of the performance measure questions in the PMT are short answers. These collect data used to track performance against goals and create a nationwide picture with quantifiable data, not only from just your program, but just in aggregate across all the programs. The second type of question we ask are those qualitative narrative questions. Open-ended questions about progress that are answered during the January and July reporting windows. These give you a chance to express in your own words how your experience has been conducting program activities. Those categories are equally important. Before we get started overviewing what's in the questionnaire, I want to mention that we've developed a tool called SCA Trax to help you keep track of data that is entered into PMT quarterly. We'll see as we go throughout this training that there are a lot of questions asking you to provide total counts of participants, breakdowns of participant numbers by certain characteristics and services received, etc. This tool is optional. It's an Excel-based tool which helps you enter data about your program participants, the services you provide to them, their admission and exit dates out of your program, and it will produce summary tables with the aggregate counts of data that we ask you to provide in PMT for your quarterly reporting. I won't be going through this tool today, but it's available to you through the downloadable file feature of this WebEx session, along with a PowerPoint user manual. And of course, it's optional, and you should not be providing that file to BJA because of the information that is in there about your program participants. So moving on, this is an outline of the questionnaire sections. Many questions have to do with counting and describing the participants you serve. If you do not focus on serving reentering individuals or are still in the planning phase, many questions will actually not be relevant to you. And we'll tell you how to best respond in PMT to provide information about your program but not have to spend too much time on those counting questions. We will go through a high-level overview in the next slide, and I won't be able to go through everything in detail, so please review the questionnaire. The General Award Information section, which is the first section, helps you track what stage your grant is in and affects what you have to answer later. If you say yes to, is this your last reporting period, the system activates closeout questions that you only have to answer at the life of your grant. For, is the grantee operational, if you have not obligated, expended, or drawn funds, answer no to skip all those short answer questions except for the open, but then you will be expected to answer the open-ended semi-annual narrative questions that are due in January and July. Next, the Program Structure and Treatment Services section covers the type of services your program offers. And this section and how you answer it determines if PMT activates questions for those service types. So, question 8 asks, what services do you provide? Pre-release or before release to the community, post-release, or both? Questions 9 through 14 basically ask whether your program provides certain types of treatment services, cognitive-based, co-occurring-based services, employment, educational, and housing. One of the common challenges in PMT is for SCA grantees that are operational, they're using their money, their SCA funds, but they're not serving re-entering participants. either because their program is not concentrated on that, or they are in the planning phase still. Currently, there is some confusing wording in the PMT system. Question 1, seen here, asks if the grantee is operational, which it defines as having active participants or reentering individuals that they're serving and using SCA funding. In fact, you can be operational as long as you have used SCA funding, even if you do not have active participants in a program focusing on reentering individuals, either because your program is not concentrated on serving those reentering individuals directly, or you are in the planning phase. Unfortunately, if you tell PMT you are operational, it assumes you will report counts of participants later on. This is an outdated feature of the system that was built when it was assumed that SCA programs focused primarily on reentry services for individuals. In fact, some SCA programs may focus instead on systematic and organizational improvements. Follow these tips to get through the system, even if you know that you have to answer zeros for questions asking for counts of participants. I won't go through these in detail now, since these steps will make more sense to you after we overview later sections. Moving on, the program characteristic questions ask questions to get a basic description of your programming, such as your target population and expected number of participants. This section focuses on participants in programs which serve re-entering individuals, as opposed to those participants that might be part of staff trainings, etc. This slide and the ones that follow have helpful hints based on questions we've encountered from grantees in the past. Though we won't go through all the details on these slides today, please use these slides as a reference when you do your reporting into PMT. They have several helpful tips that can save you time. Typically, SCA grantees determine a baseline picture of recidivism amongst their target population that the program's results can be compared against. So, the baseline recidivism section asks about the baseline recidivism rate and your goals for reducing it. We know that calculating these can be tricky, so you may need to consult TTA providers or research partners for help. The participant characteristics section helps us characterize the number of participants served in your program. The numbers of people enrolled at any point in the reporting period indicates the size of your program during that quarterly reporting period. The numbers of people newly admitted, on the other hand, when added across periods, gives the cumulative number of the number of people served since the beginning of your program. Keep in mind that we are interested in knowing the number of people served in each phase, pre-release and post-release. So, if an individual progresses from pre to post-release, over time, they will end up being counted under both. Finally, for newly admitted pre-release participants, we ask a couple of additional questions. We ask for breakdowns related to their risk levels based on assessment results, how many received case plans, and also some information about how your newly admitted participants were categorized in certain demographic categories. The participant characteristics section includes several questions to help describe the risk assessment tools you use. Risk assessments help target participants with the characteristics most appropriate for program participation. The participant characteristics section also includes several questions about activities around drug and alcohol testing and the numbers of participants tested. These are relevant only for post-release participants. The next section describes and records participants who have either completed or left the program before completing it. No, your organization might still be engaged with and providing services to certain individuals, even if they haven't already successfully completed program requirements, or they've exited your specific SCA program before completing them. In other words, they've unsuccessfully completed. Completion requirements vary by program and are thus defined by each program. These questions here prompt you to describe your requirements for your program completion. You might still be engaged with and providing services to individuals, even if they completed or exited the SCA program. However, all programs should have specific requirements that, when met, give individuals a higher chance of success after reentry. When it comes to tallying participants completed or exited from your program, keep in mind each quarter you report just those who completed or exited that period, not cumulative numbers since the beginning of the program. Also, your program may have both pre- and post-release phases with a cohesive set of requirements that actually span both those phases. Even so, when a participant goes from pre to post-release, in other words, if they're released from the facility into the community, count them as successfully completing a pre-release phase, and then you will go on to count them again when they complete or exit in the post-release phase. So what exactly constitutes an unsuccessful exit or completion? We actually list out some possible reasons here and ask you to tally the number of participants that these apply to. And of course, we include another category if needed. It may be that they had to exit your program because they're just not meeting program requirements, and they're just not meeting those requirements, not attending, or something like that. They've had a criminal situation where they've had to go back to prison or jail. They have been relocated or had their case transferred to another facility, etc. The table on this slide provides a summary of all the numbers that we asked for related to completions and exits. In addition to what we've already discussed, for the post-release phase participants that exit your program, we also ask for breakdowns related to the outcomes that they might have obtained, specifically related to their risk assessment levels, employment, and housing obtainment. Now, we've talked about counting all the participants who have started or completed your program. What about the services we provided to them? Depending on what service types were chosen in that early program structure and treatment services section, PMT will show certain questions related to the areas shown here on this slide. For each area, the data requested is actually largely the same. Members of participants served directly by the program or referred elsewhere to another organization that is not exactly part of your program. For your co-occurring services, we also want to know about the number of people that were screened and clinically assessed for substance abuse and or mental health issues. And for services related specifically to employment, education, and housing, PMT asks some additional questions related to related outcomes obtained. If your program uses medication-assisted treatment, you are also asked to report on the types of MAT offered and the number of participants treated with it. And one of the last sections that asks you about counts related to participants is having to deal with enrollments or eligibility related to health care and Medicaid. Not all grantees will track this data, but report it here if you do. And now we've reached the final section of our short answer type questions. The court and criminal involvement section is only shown at the grant's last closeout period, but you need to track this data through the life of your program. It asks for the total number of post-release participants who have had a court or criminal involvement event since the start of the SCA BJA funded program. So you can see these here, but there are also some other questions that are not here on the slide related to describing the source of this data, which you can review in the questionnaire itself. Finally, the semi-annually asked narrative questions ask you to describe progress towards goals, accomplishments and challenges in the last 6 months, and your plans ahead for the next 6 months. Answers to these narrative questions should be substantive as they provide critical information to BJA program managers. This next section is going to highlight some common reporting challenges and FAQs for various issues. Before introducing this section, we'd like to share how BJA identifies common challenges. Each quarter, we assess data accuracy and reach out to grantees with potential issues. Program grant managers conduct site visits where they may identify documentation to verify PMT data entries. Like we mentioned earlier, one of the most common challenges is for grantees that are operational but are not actually serving reentry participants. Again, the tips for how to get through the PMT reporting are repasted here, just like they were presented earlier for your reference. Now, we're almost actually to the end of our presentation today. There are a lot of remaining slides in this presentation which contain FAQs that we have received over the years. Frequently asked questions which grantees have given us about what certain terms mean or how they should interpret the questions in light of their unique circumstances. We will not go through these slides and read these, but please know that they are here for reference in case they are helpful for your situation. So with that, I want to leave you with the BJA PMT Help Desk contact information. Our office hours are Monday through Friday, 8:30 a.m. to 5 p.m. Eastern Time, except for holidays and federal holidays and weekends. We strive to return everybody's email and phone call within 24 hours, so please don't hesitate to leave a voicemail or email, even after business hours. We'll leave the webinar open for about 5 to 10 minutes so you can download any handouts attached or use the Q&A box if you have any questions. We won't be able to respond to everything live, but we will respond via email ASAP if needed. A recording of today's training and other user materials and resources will be posted online. On behalf of BJA and the PMT team, thank you for your time, dedication, and hard work. This concludes the presentation.